Imagine this. You finally get into your doctor to discuss some symptoms that have been really bothering you. Maybe this is the first appointment about it, or maybe it's one of many appointments in a long journey to get things figured out. Either way, you leave your doctor's office with a plan. Maybe it's for a prescription, a scan, or some other step that finally feels like progress. You're ready to move forward and get the care you need. And then you're told you need something called prior authorization, and you're like, what the hell is that? Well, that's the topic of this week's Healthcare Triage. Prior authorization is a process where your doctor has to get approval from your insurance company before you can receive certain treatments, tests, or medications if you want them covered. If that approval doesn't happen, your insurer may not pay. On paper, the idea is pretty straightforward. Insurers use prior authorization as a way to manage costs and make sure care is medically necessary, safe, and cost-effective. It's one of the most common tools used in U.S. healthcare to control the use of expensive or potentially avoidable services. But how does that play out in real life? Let's say your doctor prescribes a medication or orders a test. Instead of moving forward right away, that request gets sent to your insurance plan. Someone, often following a checklist of rules, reviews whether it meets certain criteria. Those criteria can include things like whether you've tried a low-cost option first, whether your diagnosis fits specific guidelines, or whether the treatment aligns with what the plan considers appropriate care. If everything checks out, it's approved. If not, the insurer might ask for more information, suggest an alternative, or deny the request entirely. And if it's denied, you or your doctor can appeal that decision. That still sounds pretty straightforward, but this process takes time, and during that time, care is delayed. Research and policy analyses consistently point to delays in patients receiving treatment as a key consequence of prior authorization. It's a lot of waiting for needed medication, waiting for a scan, waiting to see what happens next. Another key consequence is added administrative burden for providers, and that burden isn't small. It means paperwork, phone calls, resubmissions, all work that falls on doctors and their staff, pulling time away from patient care. And when your prior authorization is denied after all that waiting and paperwork, it causes a lot of frustration. This might be why only about 12% of the 4.1 million prior authorization requests submitted to Medicare Advantage insurers in 2024 were appealed. And prior authorization doesn't affect everyone equally. The complexity of the processes and baseline understanding of the healthcare system can make it harder for some patients to successfully move through the system to get what they need. In a nutshell, insurers argue that prior authorization helps prevent unnecessary or low-value care and keeps costs from rising even faster. On the other side, patients and providers experience a system that can feel slow and incredibly difficult to navigate. That's why prior authorization has become a focus of healthcare reform efforts. Across policy discussions, there's growing attention on how to make the process faster, more transparent, and less burdensome, and especially on limiting when prior authorization is required. But as of now, it remains a routine part of getting that best in the world care in the United States. So until reform happens, we'll make videos like these because understanding it before you encounter it can make things feel just a little less confusing when you do. Hey, we'd really appreciate it if you'd like the video, subscribe to the channel down below. Maybe go on over to patreon.com/healthcaretriage. Help support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Liljeholm and Christopher Learn, and of course, our Surgeon Admiral, Sam.